Hello everyone, this is Dr. Kim. So, a scan was requested by our endo resident for evaluation of tooth number 12. So what he or she, the resident, saw was that there were periapical radiolucencies associated with this particular premolar. However, the resident saw this well-circumscribed radiolucency at the midroot level of this premolar extending to this molar. So he wanted to confirm whether that is related to this premolar, the endodontic lesion, or perhaps this could be an unrelated, another type of condition that we should perhaps biopsy. So the endodontic evaluation was requested and we took a scan. And from this sagittal view, it was rather quick and easy to confirm that there are two round radiolucencies centered at each of these root apices, as you can see, right? So when I see that, that pretty much confirms that the tooth is necrotic, and that's consistent with apical periodontitis, which requires a root canal treatment. So now that the question is where is this coming from? This radiolucency located at the midroot level coming from? So let's take a look at the sagittal view for a second. Could this be coming from number 14 or 12? Looks like number 13 is missing. But what I do notice is that this extends further into the furcation right here, furcational region of this premolar, right? Rather than extending into the furcation of the molar. So if we can confirm that from this axial view. If you had to guess, right, where this radiolucency is coming from, and it could certainly be coming from within this bone, but if your only option is to choose either number 14 or 12, which one would you choose? Based on the way this is positioned, I would say it has a better chance of coming from tooth number 12 rather than 14. If it really came from number 14, maybe it would involve the apices of one of these roots, but that's not the case. But, well, it doesn't necessarily involve the apices of number 12 either, right? So what I then was doing is, why would a radiolucency extend right into the furcation? Is it completely coincidental or not? But I think I found an answer in this particular plane. So let me zoom this area a little bit. If you look here, there is a thin radiolucent channel that extends from the buccal root canal space right to the furcation. And this is not fracture because it's only captured in a few slides. If I go below that or toward apically, you don't see that. And if I go toward cervically, you don't see that. You clearly see just two root canals, but right at this level, there is that channel of radiolucency extending right into pretty much that furcational region as well as that radiolucency. So let's confirm that finding in another view. So right here, you can see the overall course of the buccal canal, root canal, and there is this lateral canal that's extending toward the furcational region. Do you see that right here? And that's not root fracture. Okay. Let's see. Could I capture that in sagittal view as well? Maybe. That's pretty much it. It's not very clear, but that's the lateral canal. Anyway, so what that tells me is that because I see a lateral canal, or if you want to call this accessory canal, I'm not sure what's the more appropriate term. I think lateral is more appropriate. But when I see that extending right into this lateral radiolucency, and knowing that this tooth is necrotic and with periapical radiolucencies, I think this pretty much answers, or should I say this fits well with all the other pieces of puzzle, that this radiolucency is most likely coming from this lateral canal that's exiting to the furcation, which means it is all endodonically like related issue, and that if you were to do a root canal therapy and provide a good, successful therapy, this area, despite how big it should heal normally, like any other periapical, large periapical lesion. So because of that feature that I'm seeing, I am not recommending I don't think the recommendation for biopsy is indicated, in my opinion, at this point, that we can do a root canal and see where this is going. And I think it will heal fine. But if I did not see a lateral canal or accessory canal extending into this area, then this could certainly be any other space occupying lesion, you name it, right? Odontogenic keratocyst or whatever the cyst or tumor that you can think of, we may have to include that. And at that point, I would definitely recommend a biopsy of this site. But I think that is no longer needed because of the information this cone-beam CT was able to provide. So you can see how important or how valuable this CBCT scan can be for endodontic evaluations. We were able to save the patient from perhaps unnecessary biopsy, not only the cost, but also pain as well, right? Okay, anyway, that's the point that I wanted to make with this video. Thank you very much for your attention. And until next time, please take care.